Hi, my name is Norah Cunningham. I am in 4th grade at Superior Elementary in the great state of Colorado. During our stay-home time with coronavirus, many people on the news have been calling them frontline workers. Many of those frontline workers work at hospitals and are doctors and nurses. I wanted to know what they do and what's it like. So I interviewed Dr. Maureen Cunningham, MD, MPH, and a pediatric hospitalist at the Children's Hospital of the University of Colorado. She's a kid's doctor, but I just call her Mom. Come on, let's go talk to her. Why did you choose to be a kid's doctor?
I like kids and I enjoyed working with them, and they were fun to have as patients. They also get better very, very quickly.
How much school and training do you need to be a medical doctor?
Well, you need 4 years of college after high school, and then 4 years of medical school. And then depending on what specialty you do, that determines how much training you need after medical school, and that's called a residency. For me, I'm a pediatrician, so I did 3 years of residency. To get a master's of public health, I got mine after residency, and that usually takes about 2 years of coursework.
What's the difference between me going to the doctor and being a hospital doctor?
I don't usually see kids when they're healthy and give them their shots and make sure they're growing well. I see mostly kids when they're sick and they're sick enough to be in the hospital. And I also see newborn babies right after they're born.
You work at Children's Hospital. Many of those kids hospitalized from flu, viruses, or other things. What do you do to help them get better and to go home?
A lot of times when we're treating kids with viruses, they don't need any medicine. They don't need antibiotics or anything. So what we do is we give them oxygen. Sometimes we have to suction out their nose to help them breathe. Sometimes they're so sick they can't drink, so we give them some extra fluids through their IV. An IV is a little tube that goes into their vein and allows us to deliver fluids to them directly in their vein if they're unable to drink. So with a lot of viruses, we don't need to treat it with medicine. Their body just kind of does the work, and we help keep them well enough that their body can fight off the virus. If they do have something that needs to be treated with medicine, like an infection that's caused by a bacteria, we'll give them antibiotics to help their body fight off the bacteria until they're well enough to go home.
Can you show me your masks and equipment?
Sure. So, this is a stethoscope. I'm sure you've seen one of these before. You put it in your ears like this, and this lets me listen to your heart and lungs and hear what's going on inside of your heart and lungs and your tummy. There's a couple different kinds of masks. There's this one and this one. These are called N95 masks. These masks are in really short supply right now, so I keep these, and if I have to use them, my name is on them, and they use UV light to sterilize them. And these are for if there's a virus or like measles or coronavirus that can get into really little droplets and spread. The mask I use most of the time is just this sort of mask, and kids can wear one of these masks. This mask isn't something that needs to be fit tested. Little tiny particles can get past this mask. It fits really loosely around the sides here. So if I had that hood on and they sprayed that bitter spray, I would definitely taste it. The particles would get in here, but this prevents bigger droplets from spreading. And that's really what we want to prevent when we're talking about kids or people outside or people in the store, is those bigger droplets from spreading. You're not going to be in a situation, and I'm rarely in a situation where I need one of these more special masks. But we don't have enough of these right now either, so I only get one of these a day. Now, before coronavirus came around, I would use a different one of these with every patient I saw, and then just throw it away. But because we don't have enough of these anymore, I get one when I walk into the hospital, and then I have to keep it all day. I have to wear it all the time, because when I'm at work, I have to get within 6 feet of people. We can't social distance at my work, so we have to wear one of these all the time. But if it gets wet, or if a patient sneezes in my face or something like that, then it's no good anymore. So in order to protect it, we've had to start wearing what we call a face shield over top of it. And that also protects our eyes from getting droplets into it too. And this is a face shield. So the face shield goes over my head like this. And this is what I have to wear when I'm getting within 6 feet of a patient, like examining a patient.
Have you ever saved any kids' lives?
Yes. When they've been having trouble breathing, we've had to breathe for them. Sometimes they have so much trouble breathing that we've had to put a little tube down their throat and then hook them up to a machine to help them breathe. That's called a ventilator, which you've probably been hearing a lot about on the news. Sometimes we have to give them medicines to help their heart work a little better, and all that stuff saves lives. But kids recover pretty quickly, and they don't tend to get as sick as adults, so we don't have to do it that often.
What's the most rewarding part of your job?
I love seeing kids get better when they've come in the hospital sick, and then seeing them get well enough to go home is probably my favorite part of the job. I also love, as part of my job, I teach younger people who are training to be doctors, so people who are in medical school and their residency, I teach them, and I find that very rewarding.
You frequently work long shifts, like 14 days at a time. What's the hardest part of working multiple weeks at a time?
Not being able to spend as much time as I want with you guys, not being able to exercise and do other things besides work.
Sometimes when I wake up to go to school, Mom has already left for work. While I miss her, I know that there are other kids that day who need her more than I do. I asked her, what can we do as kids? She said, keep coughing and sneezing into your elbow and keep washing your hands. But the real gift she received was by us staying home, and that made other doctors and nurses safer. Thank you, Colorado. But remember, if you find yourself having to go to the doctor or in a hospital, remember superheroes work there. And yes, they do wear masks fighting to get you home. I'm Norah Cunningham.